Bismillahirrahmanirrahim. This video is about 12 leads of ECG and why 12 leads are needed to conduct an electrocardiogram. You can consider every lead as a different camera or an eye placed at a different position of the body to view the heart from different angles to define different electrical changes occurring at different surfaces of the heart. Suppose this is a heart and we have to look at all the electrical activity occurring inside it, right? So we must be having different eyes at different places to look exactly what's happening and where it is happening. So there are 12 leads of ECG. 6 are limb leads and 6 are precordial leads. So the limb leads are lead 1, lead 2, lead 3, AVR, AVL and AVF. And the precordial leads are V1, V2, V3, V4, V5 and V6. And everyone knows, suppose this is a person and this is his heart and lead 1 is attached something here, somewhere here, lead 2 here, V2, then V3, then V4, then V5 and V6. Everyone knows that. So what actually happens is, and I'm going to discuss where these leads look at the heart and from which angle. So simply speaking, suppose this is a heart and this is the person whose ECG is being performed. So lead 1 and lead AVL looks at the heart or the electrical changes occurring from here, and suppose this is the eye. This eye corresponds to lead 1 and lead AVL, and lead AVR, it looks at the heart from here, from this side. Similarly, lead 2 and lead 3 and lead AVF, 2, 3 and AVF, they look at the heart from this side, from below. So from lead AVR from the right side, lead 1 and AVL from the left side, and lead 2, 3 and AVF from the inferior surface or lower side of the body. So whenever the current is approaching towards the lead, if we focus on the QRS complex, it will be positive in direction, and when it's going away from a lead, it will be more in the negative direction. That's why we have already discussed that lead AVR looks at the heart from the right side, and we all know that, and it has already been mentioned in the previous lecture, that the net vector of the electrical current is like this. If this is heart, as the current is moving away from AVR here, so the normal person will have the QRS complex in AVR like something like this. And again, lead 1 and AVL is looking at the heart from this side, and this is the heart, and net vector of the current of the flow is this. So it's towards this direction and it's approaching towards 1 and AVL. So in a normal person, the QRS complex will be like this, it will be in upward direction. Now coming to the precordial leads, suppose again this is the heart, and now we are attaching precordial leads. Lead 1 is V1 is here, lead V2, V3, V4, V5 and 6, and current is being generated here, and lead V1 is on the right side at the precordium, and the flow of the current is in this direction. So actually what's happening, that this current is moving away from lead V1. So in a normal person, lead V1 will be negative. It will be showing negative QRS complex and a negative P wave as well. Just to simplify, in this video I'm just focusing on QRS complex, and I'm ignoring the other ways for the time being, just to simplify this. Okay, now coming to again precordial leads V1, V2, V3, V4, V5 and V6. V2 is almost just on top of the heart, the center of the heart, and V3, V4, they are almost on the septum of the heart, or the septum of the interventricular septum, and V5 and 6, they are more towards the apex of the heart. So gradually we see that the R wave is elongating, and this is also called the progression of R wave. So if I draw the ECG complexes like this, lead 1, V2, V3, V4, V5 and V6, we observe something like that. V1 is negative, V1 in V2 there is a slight R wave, and in V3 there is almost balancing of the R wave and the S wave, and in V4 it's predominantly upwards, and in V5 it's more upwards, and similarly in V6 is also upwards. So this is called the progression of R wave, and why this progression of R wave occurs, that I have already mentioned. Thank you very much.